Hello everyone, in this video I'll give you a brief introduction to the dataset we are working with. We'll start by looking at the type of index event for each patient, and then we'll focus on two important clinical indicators, the Suzuki Grading scale and the modified ranking scale, usually called mRS. The index event is the first significant clinical symptom that brings a patient to a medical attention. It's the event that leads to the diagnosis of moya moya. Depending on what this first event is, patients are usually categorized into three groups: hemorrhagic, ischemic, and others. The hemorrhagic patients are the ones who experienced a brain hemorrhage, meaning bleeding in the brain. This often happens because of the rupture of small, fragile blood vessels that form as a result of moya moya disease. Symptoms may include a sudden, severe headache, loss of consciousness, or other neurological signs. When bleeding is the first sign of the disease, the patient is classified as hemorrhagic. The second group are the ischemic ones. These patients have had an ischemic event, meaning a reduction or blockage of blood flow to part of the brain. This can result in a stroke or a transient ischemic attack, often called a mini stroke, with symptoms like weakness in arms or leg, trouble speaking, or visual loss. The last group that is present in the dataset are the others group. Some patients don't have an hemorrhage or ischemia at all. Instead, some of them present with seizures as their first symptom, or others are asymptomatic, but the disease is discovered by chance during brain imaging or through screening due to a family history. In this case, the patient falls into the other category. To sum up, the index event is the first significant sign that moya moya disease is present. Whether it's hemorrhagic, ischemic, or other, the classification is very important because it helps guide treatment decisions and risk assessment. The second variable we are going to talk about is the Suzuki Grading. The Suzuki Grading helps doctor understand how much the blood vessels around the brain have narrowed or become blocked, and how the brain is trying to compensate by forming tiny new vessels. The scale goes from 0 to 4, so let's see the meanings. Grade 0 means that there's no visible sign of moya moya disease in the brain vessels. Instead, grade 1 means that there's mild or moderate narrowing of the main arteries near where the internal carotid artery splits. Moya moya vessels are just starting to appear or may not be visible yet. Grade 2 means that the narrowing is more severe or one of the main branches is blocked. Moya moya vessels are well developed, showing the brain is actively trying to create new blood pathways. Grade 3 means that both main branches are blocked, and while moya moya vessels are still present, only a few normal vessels are barely visible through this network. And to conclude, grade 4 means that there's a complete blockage of both major arteries, and the moya moya vessels are barely visible or not seen at all. This suggests the disease is in a very advanced stage, and the brain is no longer able to compensate well. The last index we want to explain in this video is the mRS. That is an index that measures the level of disability or dependence in daily activities. It's commonly used to assess how much a neurological condition affects a person's everyday life. In our dataset, each patient has an mRS score from 0 to 6. The higher the score, the more severe the disability is, which helps us understand how severely the disease has affected their ability to function in daily life. This scale is especially useful when analyzing outcomes, how patients are doing over time, and how different treatments or conditions might influence recovery. So, just like the Suzuki Grading, tells us how advanced the disease is in the brain's blood and vessels. The mRS tells us how that disease is impacting real life. So that's all for this video. Thank you for your attention.